chocolate chip. New bone broth protein bars.
All right, while she's passing those out, I'll kind of get started. All right, some of you guys know me, I think, already, but some of you don't. I'm Dr. Matt Eichler. I'm kind of the newer chiropractor here at Cypress Creek Chiropractic, but I'm not new to chiropractic per se. I've been in practice about 4 years now. So we're going to kind of talk a little bit tonight. The title of the talk, I guess, is just the big picture of health. Okay, and I want to kind of talk a little bit about what health actually is. And a lot of times people have misconceptions of what it actually is. So tonight we're going to talk a little bit about just kind of the state of health and pretty much how chronic disease, lifestyle-related chronic disease, is what's really wiping us out. All right, about 75 to 80% of deaths are due to chronic lifestyle-related disease, and that's preventable illness. Okay, so that's stuff that we do throughout our lifestyle that creates those diseases. And a lot of people think that health might just be kind of how they're feeling, and really it's not. It's more how you're functioning. Okay, so we're going to talk a little bit about this poster here in a second, but a couple definitions of just health. All right, and I've got Dorland's Medical Dictionary here, locked up here in my brain. But Dorland's Medical Dictionary says that it's a condition of wholeness in which all of your organs are functioning 100% all of the time. Now, a lot of people don't even have all their organs, right? So, I mean, you guys know we're pretty quick to just take an organ out when it tends to malfunction or if it's not 100% necessary at the time. I'd say all those organs are necessary all the time. But Webster's Dictionary says that it's basically a condition, I said a condition of wholeness there, but Dorland's says it's a mental, physical, and social optimal well-being. Okay, so optimal is kind of the key word there, all right? So optimal well-being. And, you know, when we think about function, we got to understand kind of the nervous system and how it works. And this is what chiropractors are so passionate about, because the nervous system is so important because there's different components to it. But when we have, let's just take a nerve for instance here. Chiropractors talk a lot about this, usually in their patient reports and those kind of things, but there's different components to a nerve, and the nerves have to transmit the messages from the brain out to all the organs, systems, tissues of the body. Now, when it does that, it's got different components of the nerve. So a nerve here has got two big components here, the motor nerves and the autonomic nerves. All right? Those nerves you don't feel. You don't feel those at all. Those are doing things and creating things within your body that you don't necessarily have control of. It's kind of an autonomic process. Now here, within the autonomic nervous system, that's where all this organ function is. That's where your fight or flight response is, and also your rest and digest response is. And that's what's happening in this little diagram here, okay? But it's really important to understand what health actually is. And when we kind of dive into, most people think they're feeling a pain or a symptom or something along those lines, then they're unhealthy, or they're not achieving kind of that true health. So I want to kind of map something out here for you. And we'll talk about kind of where we see, you know, marker?
Sure. Bloopers.
Didn't think about that one. Doesn't matter what color. Next. Okay, so most people come into a chiropractor, okay, in some sort of pain. That's going to represent pain, okay? That's usually what brings, or a medical professional, anybody, okay, or with some sort of symptom, all right, or some sort of disease process, okay? And they're focused on that. When they're focused on that, we're not necessarily understanding the why, right? A lot of times we don't ask why. Sometimes we'll just intervene here, we'll get something to handle the symptoms, and then we're like, let's just move on, right? But really what we need to be doing is asking better questions. So Tony Robbins says, the quality of the questions you ask yourself, or the quality of the questions you ask, is what determines the quality of your life. So we need to ask why here, all right? And when we see the pain, the symptoms, the disease process as an effect, okay, my handwriting's terrible, I'm sorry. But when we see it as an effect due to something else, then we start to understand a little bit deeper, right? So when we look at this as an effect, we gotta see what's the cause, okay? So we have a cause here. The cause is always some sort of dysfunction, okay? And a lot of times the medical profession can come on in and find the dysfunction. They can identify the dysfunction here. When we identify the dysfunction, a lot of times we can address it right then and there. We'll stop this process down into pain, symptoms, and disease. But the problem here is that we're relying on a healthcare provider to provide the health. We want to be experiencing health. before we get here, don't we? So what do we need to do? We need to ask ourselves another question. We need to ask ourselves, why did the dysfunction show up? Okay? So when we realize that this is also an effect and that there's a cause of the dysfunction, this is where we see the rampant presence of stress in our culture. Okay? Now stress, a lot of people think of just the emotional components of stress. They think, just the overwhelm that they feel, and that's stress. But stress comes in 3 different forms. We've got physical stress, chemical stress, and emotional stress. All right? Now, those also break down a little bit further. So there's usually a micro and a macro component to those stressors. All right? So what would be an example of like a macro physical stress, like a major physical stressor? Like a car accident or a major sporting injury or something along those lines, right? Just a major injury or trauma to not necessarily just your spine, but any part of your body, okay? But a micro physical stressor might just be like, I don't know, sitting all day long, or holding a certain posture or position all day long, maybe doing work on one side of your body all day long, creating an asymmetry. I always say our asymmetries create our injuries, right? So there's, we'll say MVA, motor vehicle accident there. We'll say ergonomics here, okay? And I'm sorry, my handwriting is terrible, but it's not really important. It's just kind of to keep us on track here. Well, how about chemical stress? Anybody have an idea for like a macro chemical stressor? What would that be? Like a toxin or something, right? Maybe like a food toxicity or an allergy or even, maybe like a flu bug or a virus or something, right? So let's just say like a toxic situation. But how about like microtoxins that we're constantly consuming, right? Everything in our air, in our water, pollutants in our water and in our food. And how about the processed food-like substances that we eat and pretend are food, right? So I'm going to say processed food-like substances. Michael Pollan wrote an awesome book called In Defense of Food, changed my life. The first time I wrote it, it kind of dives into a lot of the food industry and kind of how that whole situation works and how we're marketed and all those different things. But he talks a lot about those processed food-like substances. How about the emotional stress? These ones are a little bit more obvious usually, but macro emotional stress would be like death of a loved one, right? Or a major loss, a divorce, something of that sort. So let's just say loss. But how about micro emotional stress? That's the stuff we're dealing with day in and day out, right?
Your kids.
Yes, absolutely. Your kids.
Not sleeping well.
Abusive relationship, those kind of things, right? So that can really create a lot of stress all day long. And that accumulation all day long can really add up, and it taxes our system. So really what we need to do, if we want to not have this stress lead to a dysfunction, lead to pain, symptoms, sickness, disease, all those things, we need to stop it here, right? We need to handle the stress before it becomes those things. Now, are we going to make stress go away, or are we just living in a more and more and more and more stressful world? Mm-hmm. Yeah, so the more stress that piles on, we need to have strategies to deal with the stress. Right? We need to kind of understand how the stress is affecting us and have a strategy for at least building somewhat of a resilience or a healthy body or system to be able to handle that stuff, right? So the way that we do that, and there's multiple ways that we do that, but what you're going to read anywhere you go, any book, any magazine, any kind of article, anything, it's going to come back to 4 different, what I call elemental health categories, or EHCs, I like to abbreviate them. So those 4 categories are how we eat, how we move, how we think, and how we recover, recuperate, or rest. Okay? So sleep would fall into there. Your thought patterns are huge, right? Emotional stress. Movement, okay, that's exercise, but also just the movement throughout the day that your body does. That's super important that people don't really realize a lot of times. And of course, the things we're putting into our bodies, right, to kind of give us nutrition. So those 4 things are how we definitely combat a lot of this stress and build resilience and maintain health, okay? So that's where I'm trying to kind of get here, is that we got to understand that health isn't necessarily a lack of symptoms. It's doing these things, and I've heard many people say if we do those things effectively, efficiently, and sustainably, then we're going to be on our road to a very health robust kind of body and condition. So there's one thing that I know of that you guys probably know I was going to mention tonight that can pretty much facilitate all 4 of those things, okay? And a lot of people don't realize this, and you probably know where I'm going, but the chiropractic adjustment actually helps how we eat, how we move, how we think, and how we recover, along with taking care of those little aches and pains that we usually get adjusted for, okay? And the way that it does that is when we get adjusted, okay, what is going to happen is that not only are we going in there and we're moving a joint, and that helps take pressure off of a nerve, and that helps take pressure off the entire system, but we're actually balancing. The research shows that we are balancing this autonomic system, okay? So when we get kind of stuck in a fight or flight response, a lot of times that adjustment can help bring us back out of that fight or flight sympathetic nervous system kind of dominant state. It helps increase the parasympathetic nervous system. Your parasympathetic nervous system is where all these organs are kind of doing the job of helping you rest and digest and recover and grow and heal and all those things that you need to do. So when we get adjusted, definitely it's going to help with your digestion, okay? Just the fact that you're not in that stress state allows you to digest food a little bit better. And a lot of times when we're not angry and in pain, we're going to make better food choices, right? I know for sure. When I'm stressed out, a lot of times that's where I let my diet slip a little bit, right? But how does it help how we move? This one's a little bit more obvious, right? You know, when we adjust, we're usually getting in there, facilitating the joint motion. We're getting into a joint and getting that joint to move better. But it's definitely going to help how we move as far as quality goes. But how about quantity? When we move more comfortably, all right, and we're allowed to move a little bit more comfortably, we're going to move more often. So it helps with quality and quantity of movement, right? How does it help how we think? How does it, facilitate that? We're going to save that for a second, okay? We're going to come to that here in a second. But it definitely helps how we rest. Usually one of the first things that happens when I adjust somebody and I check on them either the next visit or if I call them or something along these lines, they usually tell me, man, I can definitely move better. I feel a little bit better motion, range of motion. I just had the greatest night of sleep in my life. I've heard that, gosh, in my 4 years, probably 100 plus times. I just slept better than I've slept in a long time. So it definitely helps get us out of that stress state and into a less stressed state, and definitely helps how we rest and recover. Okay, so those 4 things need to be done, like I said, effectively, efficiently, sustainably, and we will forego this whole process. Okay, this is prevention of this whole process. So the next thing we're going to talk about is how does this help how we think? Okay, because that's really cool. In the research right now, it's really kind of going to how chiropractic's affecting the brain, right, and how thought patterns are affected, and all those different things. So I've got another diagram here that I've already kind of drawn up, and we're going to talk about a little bit about the sixth sense, all right, and how this whole process works. So that's going to go on there like that. Hopefully it'll stay. Good. Okay, so this is kind of, like I said, how the adjustment's going to help how we think, and we're going to kind of dive into this. I know that looks like a bunch of mumbo jumbo right now, but we're going to kind of dive into it here. So I want you to think about your senses. When people think about their senses, what senses do we think of? These ones up here, right? Sight, smell, taste, touch, hear. A lot of people don't realize we have a sixth sense. We have a sixth sense right here. It's called proprioception, okay? And what is proprioception? It's a big fancy word. Why should I care? If you take your hand behind your back just like this, all right, and when you do that, can you see your hand? Can you smell your hand? Can you taste your hand? Can you touch your hand? You can touch your hand if you came back here with this hand, right? But you know exactly where your hand is. You know exactly where your finger is. You know here that I don't have 1 finger, maybe 2 fingers, I don't know, I don't have 3 fingers, right? So you know, right? That's proprioception. It's your body's ability to understand itself in space. It kind of knows where you should be. And proprioception is really handy when we are moving about our environment, right? Instead of opening the door and walking right into the door, that's a proprioception that allows us to understand how we have to navigate through that door. Super important when maybe we're stepping off of a curb or something like that. But really, what's so cool about proprioception is it actually affects the way that we think. It affects the way that we interact with our environment. And I'm going to show you how here, okay? So Dr. Norman Doidge, he is big fancy synaptogenesis, neuroplasticity. I don't even know how to say it, but neuroplasticity. Have you guys heard of neuroplasticity? Neuroplasticity is basically how our brain changes itself, how it adapts to its environment, and how we used to think that our brain was kind of hardwired. You had what you had, but now the research is showing, holy cow, your brain changes every single moment of every single day, adapting to its environment. So what he said in this book, and he talks a lot about proprioception, is as we become immobile, we hear less, we see less, we smell less, and we basically process less new information. Our brains actually begin to atrophy as a result of the lack of stimulation. Okay, so proprioception is basically what he's talking about here. And our brains evolved with physical movement, right? So as we move, we're really unique creatures that we stand up on two legs, and we move about our environment, and our brains evolved as we kind of came up on two legs. So proprioception was really, really heavily wrapped into this whole situation. So when we have proprioception, we are actually running that information, okay? Proprioception, a lot of these mechanoreceptors, a lot of them in the spine, but they're in our entire body, are sending information up to our cerebellum. Our cerebellum is a part of the brain that works mostly with kind of coordination and balance and kind of coordinates movement. 80% of your brain's neurons are in the cerebellum. Isn't that incredible? 80%. So it's a heavily packed, dense area of neurology. But when we stimulate proprioception, it stimulates the same pathway that runs up through the cerebellum to the thalamus. That integrates and relays information out to your five senses. Okay? Now, let's think about in the case of stiffness here. When we have stiffness, all right, and I'm going to explain why we get stiffness, it actually roadblocks proprioception and doesn't allow your brain, I mean, you still get some information, of course, but you don't get optimal information up to the brain and out to those senses. So, why do we get stiff? If proprioception is so intricately woven into all this neurology, why do we even get stiff? Well, stiffness comes from what we call fibrosis. All right? Fibrosis is a fancy term for, can be scar tissue from an old injury. It can be actually a fibrotic wall around a virus or bacteria or something in the blood. Maybe even a food particle that's not digested completely, right? And that's leaky gut syndrome, where we get an inflammatory response that creates fibrosis around those particles. That's inflammation. We're going to talk about that in a second. Or maybe just an adhesion in a joint that's not moving. Okay? If you don't move it, you lose it, right? So when that adhesion lays down in the joint, we know that that's part of an inflammatory process. So fibrosis comes from inflammation. Okay? And you guys have heard a lot about inflammation, I'm sure. But inflammation comes in a lot of different forms. And what does it come from? It comes from stress, physical, chemical, emotional stress. But let's just kind of talk about a couple specific examples. So how about like, you guys have heard probably about the omega-3 to omega-6 ratio. You ever heard of that, right? You have too many omega-6s as opposed to omega-3s, which our standard diet does. You're inflammatory. You have an inflammatory kind of reaction happening in your body. You need that balance of anti-inflammatory fatty acids. How about mechanical stress and strain? All right. There's actually research out there that shows right now high school students are looking like this, more than 5,000 hours a year. I mean, that's incredible, right? You can imagine that's going to lead to some inflammation. How about an old injury, okay, that's just never been completely corrected? It's never been completely fixed. Constant inflammation, chronic inflammation. How about vertebral subluxation complex? That's what chiropractors work with. That's when the nerve gets pinched or irritated by a bone that's kind of slipped from its normal position. There's a lot of different ways to explain that. But all those different things lead to inflammation, okay? Or just processed food-like substances that I'm talking about that we eat all day long. Inflammation in your body leads to fibrosis. Fibrosis in the body, whenever there's fibrosis, you're going to create some stiffness. And that inflammation leading to the fibrosis, leading to the stiffness, is going to decrease the proprioception. Okay? And that's where we come in. That's where chiropractors come in. All right? So, the chiropractic adjustment is a very unique mechanism that can kind of counteract this whole process. All right? So when we come in here as chiropractors and we actually adjust those joints that are kind of basically lacking the proprioception or lacking the stimulation that they need to reconnect to the brain here, then we're just not going to have that optimal neurology happening out through those five senses. So when we come in, there's a specific mechanism. When chiropractors adjust, you've probably seen how we adjust, right? There's certain joints that might move and you might hear a click or a pop. But really what's happening is we have an active range of motion, okay? So if I do this with my finger, that's my active range of motion. This would be my passive range of motion, okay? What chiropractors do, and we're very skillfully trained to go just beyond that passive range of motion and very lightly and comfortably into what we call the adjustic range of motion, okay? Or we call it the paraphysiologic space as well, okay? That stimulates proprioceptors, okay? The mechanoreceptors that have proprioception. and allow that to happen directly, and it decreases the stiffness. So it's kind of a double whammy here. That frees this situation up so we can get information back up to the brain, kind of reconnects the brain with that segment or that joint, all right? And then that integrates and relays the information out to the senses, enhancing the senses. So when we have an enhanced sense, we have better decision-making ability in our environment. So it kind of helps how we think about things. It helps how we actually are thinking and processing the environment, which is really cool. It gets me super excited. So when I'm adjusting somebody, this is more what I'm thinking about. I'm not necessarily thinking about just opening that joint up. Of course, that's got to happen. But I'm thinking about, holy cow, I'm changing how this person's thinking. And that's what gets me super fired up and excited. So I really just kind of wanted to recap, like I said, that proprioceptive system, super important. That's really what's happening when we're adjusting. We're stimulating the neurology of the nervous system. But it's the stress that's creating the inflammation. It's the stress that's creating that cascade down into, dysfunction, pain, symptoms, sickness, and disease. And we need to be thinking a little bit more about, hey, how can I minimize, manage, build resilience to that stress to begin with and prevent this whole situation? Okay, so that's pretty much the basis of the talk. I want to just kind of inspire you, hopefully, to think a little bit more about how you're eating, moving, thinking, and recuperating, all right? And understand that the adjustment is really tied to that, and it can really enhance that, all right? So, cool. Any questions on anything there? Anybody, we're going to have some gifts and stuff, and any, yeah. Anybody got any questions on that? It's a lot of kind of heavy stuff, right? A lot of big words. Yeah, so. Cool. All right. That should be good.
Well, thank you.
I appreciate you guys for coming, man. I appreciate you guys.
Yes.
Thank you.
Have any questions?